We also don't have the resources we need. I don't need to go on about that, financial, human others. And at the end of the day, about how do we change what is already happening, and we need a new mindset in order to be able to do this. So just to wrap, way forward, we need to be proactive. That's why it's talking about what we expect to happen and how we can plan against it. And so we need to know that IDC is not about outbreak risk. It's very when there's it's about delivering safety and quality healthcare. And when we do have a normal pathogen, then IPC can bring us to transition. IPC is connected to other authorities that already said, and then we know that if we just focus on training alone, we've seen the core, we've seen the multiples. You need all of those together in a system in order to make these things better and to improve what we have. So from here, we need to sustain funding that COVID-19 has given us in the health sector. We need to also establish horizontal at the state level, community level, using pathways that we know and can work. At the end of the day, while COVID and crisis is also an opportunity for us to build our health sector and embed this IPC to save lives at the end of the day. Thank you very much.
Thank you very much. Every time I Dr. Stella national hero. May her soul continue to rest in peace. And thank you very much for your presentation. Very informative. We cannot emphasize the conversations like this that we just had. Very thank you so much once again. Can we please just applaud her? Thank you so much. Thank you. We're looking forward to IDC by the federal government that we can have. Thank you so much. All right, as we move on, we are on the last presentation day. The second day, and we are taking presentation now. This will be done by Dr. Rush, communication expert of health board. Speaking of the role of data and cultural insight in outbreak response. I'll have his bio very before he comes up. Dr. Rush, now personnel of the Ministry of Health in Luxembourg. He specialized in health communication during infectious outbreaks, developing evidence-based outbreak response measures on community collaboration and user research. He has gained extensive experience developing targeting communication campaigns, increasing public health awareness, counteracting myths and disinformation. As an independent consultant, he has worked in industry and government conducting qualitative and quantitative analysis of public health. He holds a PhD in applied statistics from University of London, where he also worked as a teaching associate with a specific focus on research method and health communication. Ladies and gentlemen, as we have our final presentation for today, please join me as I welcome Dr. Tom Rush, communication expert, Ministry of Health. Round of applause. Thank you very much.
All right, thank you very much for that. I'll try and keep it very brief. Morning. I don't want you guys too long before we had to lunch. Before I start, I stand on the protocol, and I also want to congratulate GET for putting together yet another amazing conference, the seventh. It's been going around throughout the years, and it's a sign of the organization's persevering with the work that they do. As already mentioned, I am from Luxembourg, and I work for the Ministry of Health in Luxembourg. Luxembourg might not know it, it's a tiny country in the middle of Europe. Today I want to talk about communication in the field of outbreak response. So I want to specifically look at the role of data and insights in outbreak response. And there's no need to really look at the detail of the slide. I just want to make a point at the beginning. I think one element that has really been stood out through the entire COVID-19 pandemic. It's the production of amazing amount of data. It's been everywhere. It's been driving decision makers, policy makers, and every decision is based on evidence. It's based on data. Here, just a few examples. See vaccination rates, see the different variants that are circulating in community. What the right to be in Luxembourg, we're monitoring the wastewater and the levels of virus in wastewater. So there's just an amazing amount of data that is being produced. And what I want to argue today is that also need to rely on data and have a data-driven when it comes to communication during outbreaks. So before I go into more tactical aspects of the presentation, I just want to quickly read out this quote from the Build Back Fair COVID-19 Environment Review. And it reads, COVID-19 further revealed that inequalities and how there are clear socioeconomic inequalities and mortality from the disease. So basically what Mark and his team are trying to say here is that the virus is not impacting everybody in the same way. There are clear differences in the way our communities and the subpopulations are being affected by this virus. And it's important to bear this in mind when we're trying to fight against the ongoing pandemic. And that basically raises two questions that I want to address today. The first one who is the most vulnerable? So who are the people in our society that are being affected the most by this pandemic? If we want to have those that are being affected, we need to know who they are. We need to take an approach where we understand where the vulnerabilities are, what's economic, cultural, whatever it may be, who those people are. And then in the next step, we need to think about how we can reach them. And that's where communication comes in. But for now, I want to focus on this first question that I pose here. So who is the most vulnerable? When I started my current role at the Ministry of Health, this was the first question I asked myself and I asked in general, who is it that is currently impacted the most by this virus? And out of this question, we developed collaboration between a number of institutions in Luxembourg, namely between the Ministry of Health, so the Ministry coordinated this effort together with National Office for Statistics, our Office for Biosecurity, and also the Luxembourg Socioeconomic Research. And we launched the study of the socioeconomic gradient associated with health outcomes in the resident population. So we looked at the Luxembourg population, and we wanted to look at outcomes of the SARS-CoV-2 pandemic in Luxembourg. And those outcomes that we considered were infections, hospitalizations, ICU admissions, and deaths. So we wanted to look at those four outcomes to better understand what's happening in our resident population. And in order to understand them, we looked at a number of variables. So we looked at demographic variables such as age, sex, country of birth, and a number more, and also socioeconomic variables. So we looked at professional sector, income, household size, social benefits, so whether or not people are receiving social benefits. And we looked at those variables together with the outcomes of the pandemic in order to answer the question, have some population groups been particularly vulnerable to COVID-19 impacts? Basically understand, as I said earlier, who the vulnerable people are in our society that we need to reach, that we need to try and protect better. And in order to do this study, and I'm not going to talk about the methodology in a lot of detail, because that goes beyond the point I'm trying to make today, but we work together with our Social Security office in order to look at every person registered in the country. So they are registered through their social security number, and link them with those demographic and socioeconomic variables that I mentioned earlier to understand who is being infected, hospitalized, who is being admitted to ICU, and who's dying from this. Basically, to better understand, as I said, how the virus is entering and behaving in our national population. Right, so here are some results, and again, the point of my presentation today is not to look at those results in detail, but I just want to highlight a few results that stood out and that are important for the point that I'm trying to make in terms of communication efforts. So we found that, you can see here at the top, people that are receiving social assistance benefits, they tended to be infected more than people that are not receiving social assistance. So there's something going on that one. Additionally, if we look at the bottom, I'm not sure if you can read it, but I'll just explain it to you. The professional sectors. We saw that there are a few professional sectors that are standing out where we can see increased infections as compared to other professional sectors. So for example, the construction sector stood out as a sector that is being impacted more by the pandemic than other sectors in terms of infection rates. Or the hotels and food services sector, so restaurants and hotels, there seem to be more infections happening in that sector as compared to, for example, education sector. Also, of course, the human health, social work was impacted a lot as well, but that is to be expected because those are really the frontline workers. So here are some more results, again looking at the same categories, but just over time. So we didn't just look at the overall picture and look at what's happening in those different professional groups, for example, but we also looked at the different phases of the pandemic. So on the left, you can see, I'm not sure if we're looking at the same slide. I think we're looking at the same slide now. So here we can see that the construction sector, which I mentioned earlier, actually at the beginning of the pandemic wasn't as impacted by the virus as compared to later stages of the pandemic. So we can see that there was something happening along the line of the pandemic, and that things changed. And what I'm trying to say with this is that it's important to look at what's currently going on in the pandemic in order to develop impactful and evidence-based activities. Right, and here on this slide we're looking at hospitalization rates. So again, we found some interesting elements when we looked at hospitalization rates. So we saw that the higher the income of a person is, the lower the likelihood was that a person would be hospitalized as a result of a COVID-19 infection. Similarly, we found again that people receiving social benefits are more likely to be hospitalized as a result of an infection. So why are these kind of results and insights so important? Why are we doing this research in order to get those details? So first of all, it's crucial insight into virus penetration in your population and in its socioeconomic and cultural subgroups. It tells us how the virus is behaving in our society, where it is circulating more, who it is impacting more, who is having a harder time dealing with the virus, who's really the most vulnerable section of our society.